Okay, everybody, how you doing? This is Dr. Gelfound again. We're just going through some exercises for the low back. And today we're going to do some things that require the exercise ball. This is a great low-tech, inexpensive way to work with a low back pain patient. And one of the things this is really great for is pregnant moms. So basically what we're working on here is the pelvic area with the lumbar spine. And in a pregnant mom, this area right here is the sacroiliac area with the sacroiliac joints, and the baby for most of the pregnancy sits up here, but then this is the pelvic inlet, this little ring, and as the baby starts to drop down and turns with the head going down, sometimes there's a lot of stress right here. Now, when a mom experiences back labor, it's usually from the pressure that the baby's head produces right here called the sacral ala. And that pressure can produce a tremendous amount of back pain for moms. Now, in physical therapy, chiropractic, athletic training, or any kind of manual techniques, a lot of times we can't do other pain management protocols for the moms because they're pregnant. And there's a lot of things that are contraindicated for pregnant moms in terms of using ultrasound or electric modalities, just because you don't know what's going to happen to the fast dividing cells of a growing fetus. So many times all we do are simple manual techniques, exercise, adjustments, and massage. But this is a home exercise technique that is really great for the moms. It loosens up the joints and the pelvic pubic symphysis right here, which is not quite the same kind of joint as these joints. So basically what we do is we have the patient sit comfortably on the ball and feet kind of shoulder width apart. This provides some stability. If they put their feet together all the way, go ahead and put your feet together, that provides a narrow base, much more difficult to stabilize themselves on a dynamic surface and requires more activity of the lumbar paraspinal muscles. So separate again, and now just start bouncing. Put your hands on your hips and sit up nice and tall, good posture. So we want the ears over the shoulders, shoulders over the hips, and this bouncing position makes the vertebra do a little bit of a what we call imbibition, where the bones are just kind of doing this thing. And what that does is it imbibes the disc. Imbibition is the process of squeezing fluid in and out through the disc. Really helpful for the low back pain patient. So now swivel your hips side to side. So again, swiveling the hips side to side gets the sacroiliac and the lumbar spine more mobile. Okay, now front to back, front to back. Okay, these are like pelvic tilts. And then circles one direction. And then circles the opposite direction. Okay, now go back to bouncing. And just put your feet a little closer together. Now balance on this leg and take this heel, push it out and back down. That's it. Much more dynamic, needs a lot more stabilization of the lumbopelvic area. And if you were to incorporate arm movements, so go ahead and stabilize yourself with your feet. You can separate a little bit more. Now bounce a little bit. Okay, now just move your arms up and down. Okay, so if you had a small weight, now move a leg in and out at the same time. Much more of an advanced exercise, arms incorporated, legs incorporated, stabilization of the lumbar pelvic. This is a great exercise for low back pain patients and great exercise for moms. If a patient uses a larger ball, they can do a lot more things with stretching frontwards, backwards, sideways over a larger ball. Sometimes smaller balls are a little bit difficult, and I'm going to show you why. Okay, so here's a couple reasons why you want to pick a different size ball. This is a 55 centimeter ball. It won't blow up much bigger than this. This is a 75 centimeter ball, and there is another size, 65. There's even bigger sizes than 75, all the way up to 95. The larger balls just allow you to do more different exercises in a total body range of motion. These balls are limited. So Neil, let me show you what happens here. Sit down here on this one, face that way, sit up nice and tall, come back a little bit more onto the ball. There you go. Many times what we don't want is we don't want the hip joint much lower than the knee. This is pretty good for Neil. He shouldn't be on anything lower than this. This helps keep the ear, shoulder, hip all aligned, keeps the back all aligned. Okay, stand up. If he goes onto a smaller ball, sit on it nicely. Now look at where the hip is and the knee is. This flattens out the lumbar curve. This makes it a lot harder on his low back. So it's not as pleasant for the patient when they're doing the exercises to be on a small ball.